Hi, this is Junaid, and I'm going to present continued medical education in neurology, especially for non-academic providers, as academic providers have more opportunities to complete their CMEs. There are no specific disclosures for this particular lecture. Of course, my general disclosures are there. Please pause the screen if you want to view them. So what is maintenance of certification, and what is CME all about? Maintenance of certification is a key quality marker, and insurance, hospitals, federal governments, quality organizations all look at it to basically make sure that you are continuing to educate yourself and therefore are awarded maintenance of certifications, which are generally awarded by the boards. The general shift initially was that the maintenance of certification used to happen every 10 years, and you would take another board exam every 10 years, but more recently that has changed, and it has changed towards what we call continuous maintenance of certification. And the reason behind are two major. Number one is 10 years is really now considered too long. Clearly the medical field advances pretty quickly. And of course, more importantly, I suppose, is that credentialing bodies cannot live with money every 10 years, and people sort of sometimes don't apply for it. So the whole paradigm was shifted towards continuous maintenance of certification. So maintenance of certification, MOC, has four components. Number one is professionalism and professional standing, which just basically means that you should have at least one state current license, and that's unrestricted. And the idea behind it is that if you are at least have one state recognizing you as a physician, then you are in a professional standing. Number two is lifelong learning, which is CME, and then they have different components to it. Number one is self-assessment, and number two is patient safety, which we'll talk about. Number three, assessment of knowledge. That is important as well, because not just that you're educating, we are actually somehow assessing that you are getting more and more knowledge. So there is a recertification track, which was basically initially 10 years every, and then you would take one exam. But now, at least American Board of Psychiatry and Neurology, ABPN, has moved to a continuous mock program, which was piloted from 2019 to 2021, and from 2022 this will be the permanent way of doing things. And number four is improvement in medical practice, and one component every year, either clinical versus feedback, needs to be completed. The references, if you want to look at it, is in the bottom. So what is CME? So physicians have been using CME that they have participated in educational activity. Basically, one CME was equivalent to 1 hour of educational activity. There are two major categories of CME. One is regular CME, which basically the requirement is 30 per year or more. The better way to look at it is 90 every 3 years. And CME self-assessment, which is a special type of CME which has a self-assessment component attached to it. Generally speaking, these are multiple choice questions at the end of the paper, article, or whatever you're reading. You're assessing at least yourself personally that way. So this is a subtype of the CME, and then you are required to have 8 per year or 24 per 3 years. You can have CME SA type or self-assessment type, all 90 of them, every 3 years. So you should consider this as a subcategory of the CME. At least have 24, and if you want to have 90 of them, feel free to have it. The best website that I recommend to actually follow through is the AINeuroCare. I think that is the must-have utility for every neurologist, so that they can automatically add CMEs from AIN resources. One of the best resources that I regularly use is the Continuum, the AIN meetings. So what you can do is basically, as you're on the AAN website completing these CMEs, it automatically logs it into the NeuroTracker, and more importantly, it sends all the data to ABPN, Physician Folios. So you basically don't have to do anything. American Academy of Neurology actually helps you track your CMEs and also report it to ABPN. So understanding the requirements from 2006 to 2011, we are still at the 10-year mock program. Once recertified somewhere between 2016 to 2021, they will move to continuous mock. From 2012 to 2015, those graduates will be added into the continuous MOC programs. And then in 2016 onwards, they will also be in the continuous MOC programs. The difference is they have to do one-time patient safety evaluation. That will not be needed, period, after once. So here's the 2016 to 2011 where our senior neurologists will be in. So they actually have to complete 300 credits in 10 years, have to do one MOC test in 10 years, etc. And from 2012 to 2015, they will be on a continuous MOC program. Basically, they have to prove every 3 years their CME and their self-assessments, but they still have to take the MOC exam, one test at the end of the 10 years. However, this is the current model where everyone is eventually going to shift to, and that is basically the continuous MOC program. You have to do one course, 90 CMEs, self-assessments, PIP, and MOC test, one every 10 years. This might actually go away, the 10 years program, and this is where the pilot program comes in. The details are still being formulated. Some people have been given this, that every year they're about to do some of these tests, and eventually the 10-year MOC exam will be waived. So there are multiple places where you can complete your patient safety evaluations. If you go to this website, abpn.com, maintain certified AB and approved product list, you can actually see multiple places where you can do it. AAN, American Academy of Neurology, has a patient safety course. ABMS has an NFS patient safety course. ABMS also has a safety course. They're mostly around $100 to $200, and that's a one-time requirement, especially for people who are graduating from 2016 onwards, to complete one-time safety evaluation. ABPN approved CME improvement in medical practice. There are multiple ways to do it. I think these 5 are the most easiest way, in my opinion, to do it. As a matter of fact, if you go at the very bottom, ABPN supervisor evaluation feedback form, one supervisor can do it, and then that actually fulfills your requirement for PIP component of it. So overall, my recommendation is use AINeuroCare, use Continuum for CMEs. All of them includes self-assessments. It's a fantastic place to get your CMEs and actually get educated. AN meetings, best place for networking and CMEs, and you can actually directly put them into your NeuroTracker. For PIP component, I recommend a supervisor feedback form, very easy. And then MPSF patient safety curriculum, which is basically a pretty extensive course, and depending on how much it's going to be costing you, somewhere between $199 to $399 if you're a member or not, it's probably the best, easiest way to get your CME out of the ways and fulfill your requirements. This lecture does not touch on particular requirements. For example, if you are a stroke physician, most stroke physicians do require a separate 8 CMEs per year in the stroke. Please be aware of that and complete that as needed. So one of the key things that people keep asking is, like, why is this important? And it is extremely important. Self-assessment in lifelong learning and improving performance in practice. Physician, know thyself. This is a fantastic article written back in 2006 in JAMA. A medical professional accomplishes accountability by providing its members periodic measurements of performance using reliable, valid instruments and judging performance against evidence-based standards, providing graduate and continuing medical education programs. I think it's extremely important, in my opinion. People think that this is just boards and it's just a money grab, but either way, I think it's extremely important. And this is where it really comes down to. This is a fantastic, like, one-page article, literally, in Practical Neurology, and it says neurological reflections, and fantastically worded. And they actually basically went, and he actually refers to this particular paper, Unskilled and Unaware of It, and how difficult it is to recognize one's own incompetence. And as a matter of fact, it leads to inflated self-assessments. And it is important for everyone to continue to recognize where the weaknesses are. And believe it or not, we're not good at it, and nobody's good at it. I mean, not just physicians. If you have time to read this is what I would recommend as further reading. Yep, this is the New Yorker. Way too general practitioner. And as you can see, good news is your cholesterol has stayed the same, but the research findings have changed. As usual, thank you. Please subscribe and visit my website. Thanks.